The whole event is focused on giving you the information about why we are discussing cancers, what is the need to discuss, whether they are preventable, how many preventable, and what can you do to reduce that risk. So all you need to understand over here is that you as educated lot have to get the information, and then it should not stop here. It has to go beyond these four walls. It has to be on your groups, in your campuses, so that everyone is enriched and enlightened and knows the ways, and you are the mode to do that. There are 100 different types of cancers, but this month, as March is being celebrated as Colorectal Cancer Awareness Month, and the ribbon for awareness is blue, and hence this name Bluethorn. We have a lot of activities going around in the country for various cancers, but nothing has been started for colorectal cancers, and this has been the first of its kind event in the whole country, and we should be very proud that our state has initiated this, and we are a part of this history making. So this disease affects 18 million new cases every year. 1 out of every 4 deaths in the country is just because of this dreaded disease. That is why we have assembled over here and we are going for these awareness sessions. 70% of the deaths, unfortunately, are from the low and mid socio-economic groups or countries, and we belong to that. And that is again another reason to discuss all that. So if you see, we are having 6 to 7 lakh people actually losing their lives annually to this disease. And when we talk about these figures, these are underestimations because the registries across the country are not being maintained very well. So all the cancer patients are not reporting to those registries. I would request the students at the back to be a little more silent and attentive to the talk, because this is an information that you need. Our cancer screening camps are for the high-risk population. Cancer awareness talks are for the youth, because lifestyle modifications you guys have to do. It is your life. Take charge. 30 to 50% of the cancers are preventable. So you need to understand that. We are here because we can prevent that up to 50% cancers. So anybody and everybody that you talk around with would have any of the friends, the relatives, the neighbors, or anybody they know, any near and dear one has been affected by this dreaded disease. So all the more important for you to understand, so that you know what has happened to your family members, your neighbors, your friends, and how you can prevent yourself and your near and dear ones from all that happening. 50.55 million cancer survivors across the globe. And we are losing close to $1.16 trillion US dollars on management and treatment of these cancers across the globe. Why are we here? Because cancers are conquerable. So we are out to conquer, but only with the support of people understanding that you have to be attentive towards the subtle signs and symptoms, and you have to present in stage 1. God forbid, if anybody gets it, they have to be very attentive. Presenting in stage 1 means 90% overall survivor. And if the same person presents in stage 4, we lose close to 60-70% of those patients, only 20-25% of the survival. This is why we are here, and this is what we have to reiterate. Cancer is not end of the life. It is just a bend in the life, and we are here to make that ride very smooth, provided we get that support and reception.
If anybody says gradual in life doesn't exist, gradual means you are in a phase of convincing yourself. No harm done. Take your time. But if you want action, it should be now. What is needed? Many times I keep coming because I have spent good part of my career here. I am here as well as there for past 16 years. And wherever I sit, first question is asked, what India should need in, everybody compares with the United States and developed world. What it needs, and I'm repeating the same thing today, India needs awareness. You can't take education as an excuse. It would be lifetimes and millions of people would die of advanced diseases. We are a museum for advanced diseases in the world, simply because there is not a simple word of awareness. And awareness, if we fail in making everybody aware, we as the elite part of society has failed miserably in doing our duty. We are so self-centered, specially focused, but we don't bother about talking to a boatman or a caretaker or a driver who take your word as a gospel truth. You have to initiate a conversation. I think there should be about 200 people here. Straightway I would say multiply 200 people. If they take a pledge, they will talk to one man and convince him on the cancer. Mind you, they hold you in very high esteem. They realize that they are not literate. They don't have wisdom to understand. If you just talk to these people that look, you are likely to develop cancer, 2 sentences. If you can pick it up, cancer is no big deal. But in India, we are very good at complexing things and then get busy solving these problems. We keep on waiting for diseases to come. She emphasized the right thing of lifestyle. Now, so far we talked of the underprivileged society or lesser soul, so to say, in this world. We haven't talked about ourselves. We would have our plans to go to barbecue and have all kind of food without awareness, thinking that education would prevent the cancer. No, it would not. In US alone, 30 to 50% colon cancers are preventable by periodic colonoscopy. My insurance would not let me continue until I do colonoscopy every 5 years. Everybody has to do that. It's no big deal to find out whether you have a black colored stool or not. They are very simple things. You don't have to be a doctor to do that. All I'm telling, society has to do. In this country, I used to say I worked in state government for 20 years. We are so attuned that even cleaning our space or office, we need a government order. We are totally dependent on the government, whereas we forget the power of individual in this society.
I congratulate the organizers, the University of Kashmir, the Department of Tourism, the Association of Colorectal Surgeons of India, and other organizers for having organized this Shikarathon and then this awareness program on a topic which is of tremendous importance. And I think as Dr. Nisar was saying, that not only the University of Kashmir, all the universities in the Kashmir Valley have to be the torch bearers of creating awareness on issues which are of societal importance. He was talking about the drug de-addiction or the drug addiction, cancer. So I think there are a lot of issues, that our society is facing, and the universities need to be at the forefront of, coordinating and organizing these events. Human memories are very short, but all of us at certain point in time have faced a very distressful, connection to the cancer. Either one of our family members, or our dear colleague in an organization, our neighbor, or our relative has faced. We have seen many of these because it is very unfortunate. The Jammu and Kashmir has the highest rate of incidence of the colorectal cancers. Now, if you look at the global level, so it is the third, if you see the colorectal cancers, they stand at third. You have the lung cancer, you have the breast cancers, you have the lung cancers, and then you have the colorectal cancers. And in Jammu and Kashmir, if it is at the number 1, and if you look at the globally, the incidence and the deaths, if you see per unit population is coming down. Why in Kashmir, the incidence and the rate of death of the patients is increasing. I think this is a challenge for the academicians, for the scientists, for the doctors of this place to investigate it. I think it is very important for us. I don't know, I am not aware, but I'm sure the Sikkim and other institutes in the Kashmir Valley must be maintaining a patient or population register of the cases, meticulously. I think that is the basic, that will form the basic database, the main primary data for investigating the reasons for the increase in the incidence of the colorectal cancers in Kashmir. Now, if we have a very detailed profiling of these patients in terms of gender, in terms of age, in terms of background, in terms of the places, geography that they come from, and the environment they are exposed to, I think that will give us the first leads, first understanding, first causes of why the incidence of the colorectal cancers is increasing in Kashmir.
The need for active collaboration between many organizations. This event itself is actually a reflection of the beginning that has been made by Dr. Shabnam and the University Health Center. And I must tell you, sir, our series, the Center for Interdisciplinary Research and Innovation, University of Kashmir, they have won a grant of 10 crore rupees under the title Builder Program from the Department of Science and Technology. And this grant is actually to answer some of the questions. Why some cancer types are very prevalent in Kashmir. So this grant is for a period of 5 years, and I am sure that with this research project coming to its completion and many other projects that the university will undertake through the series, we will have very plausible answers to some of the most challenging questions of the day regarding cancer and the prevalence of some cancer types in Kashmir.
कश्मीर यूनिवर्सिटी जो एकेडमिक और रिसर्च कंपोनेंट इसमें ऑलरेडी बहुत अच्छा काम कर रहे हैं। उसके अलावा आज जो हमारा एक्सटेंशन एक्टिविटीज़ का कंपोनेंट है यूनिवर्सिटी ऑफ कश्मीर की तरफ से, उसी के अंडर जो आज हमने यहाँ एक फर्स्ट ऑफ इट्स काइंड शिकाराथन कंडक्ट किया था यहाँ नगीन लेक में, और हमने जो कोलोरेक्टल कैंसर अवेयरनेस प्रोग्राम के तहत हमने ये प्रोग्राम रखा था, जिसमें हमारे और कुछ साथी थे, जिसमें हमारा कोलोरेक्टल कैंसर सोसाइटी एक पार्टनर थी। इसी तरह से जो यहाँ आज हमने अवेयरनेस प्रोग्राम किया, जिसमें हमारे एनएसएस के कोऑर्डिनेटर डॉक्टर मुसव्विर और उसकी टीम, सारी टीम थी। तो सारे नगीन लेक में हमने एक अवेयरनेस कैंपेन स्टार्ट की थी, और इसके बाद जो लेक्चर हुआ, जो अवेयरनेस कैंपेन का मोटो और उसके मॉडलिटीज़ डिफ़ाइन यहाँ किए गए। तो ये एक हमारी जो कश्मीर यूनिवर्सिटी का ऑलरेडी जो मैंने कहा है कि जो एक्सटेंशन एक्टिविटीज़ अवेयरनेस कंपोनेंट जिसमें आता है, मुझे लगता है ये बहुत अच्छा कदम है, खासकर हमारे यूनिवर्सिटी हेल्थ सेंटर की तरफ से। पर्टिकुलरली जो हमारा हेल्थ सेंटर अर्लियर काम कर रहा था, वो यही जो प्राइमरी हेल्थ सेंटर जो काम होने थे वही कर रहे थे, मगर एज ऑन डेट आपने देखा होगा इससे पहले भी हमने कुछ अवेयरनेस लेक्चर प्रोग्राम्स के यूनिवर्सिटी में ही, चाहे वो डायबिटिक पर था, चाहे वो हार्ट एलिमेंट पर था, चाहे किसी और डिज़ीज़ या जो हमारे ऑप्थेमोलॉजिकल इश्यूज़ होते हैं, डेंटल इश्यूज़ होते हैं, सब पर आजकल काम चल रहा है। और इसी को आगे बढ़ाते हुए हमने आज कैंसर अवेयरनेस के बारे में ये प्रोग्राम रखा था। तो मुझे लगता है कि जो भी सोसाइटल इश्यूज़ हैं, जो सोसाइटल प्रॉब्लम्स हैं, कश्मीर यूनिवर्सिटी हमेशा तो आगे ही काम करती हैं, और मुझे उम्मीद है कि हम इससे आगे भी अच्छी तरह से काम करेंगे, पर्टिकुलरली टू कंट्रीब्यूट द सोसाइटल जो भी प्रॉब्लम्स हैं उनको एरेडिकेट करने में कश्मीर यूनिवर्सिटी का हमेशा साथ रहेगा।